As the population ages, Alzheimer's disease is becoming much more of a concern. So I'm here at the Harvard Institute of Medicine to talk to Michael Wolfe about what causes Alzheimer's disease and what we may be able to do about it in the future. So what is Alzheimer's disease?
So Alzheimer's is a neurodegenerative disease, meaning neurons, brain cells are damaged and die over the course of time. And this is caused by two proteins in the brain clumping together inappropriately, one called the amyloid beta protein, or A-beta, and the other is called tau.
So basically, if you look at the brain of someone who has Alzheimer's disease, you find proteins built up in places where they shouldn't be.
That's right.
And they build up in the neurons or on the neurons themselves, and they affect the function of the individual nerve cells in your brain.
That's right.
So how does that happen?
Yeah, so as we age, our brains seem to be less and less able to handle this amyloid beta protein, or A-beta, that builds up in the brain. It's a residual piece that is formed from a larger precursor protein. There are molecular scissors, enzymes that cut out amyloid. The other pieces of the precursor seem to have important normal functions, but this little residual piece doesn't seem to have a function. But over time, brain is just less and less able to clear it out effectively, and as we age, it builds up and ultimately causes problems.
So it sounds kind of like a piece of trash that the brain doesn't need, that it is good at disposing of early in life and just gets worse at.
That's right. So the amyloid piece is not generally thought to have a normal function. And so you can think of it as a piece of trash, and normally the brain can take out this trash, but over time it just has more and more trouble doing that.
So if we can prevent that from happening, would that prevent Alzheimer's disease from actually hurting you?
Well, there's an awful lot invested in that idea. So there are therapeutic trials going on with agents that are designed to block the formation of amyloid or to interact with amyloid and to clear it out from the brain.
And this second protein that you talked about, tau, that seems to come about after the amyloid's been there. So if you stop the amyloid, would it also maybe stop the tau?
Yes, there's good reason to think that that's true. The evidence is that the amyloid protein buildup is what's happening first and ultimately causes the problems with the tau protein, causing it to form aggregates or filaments inside the neurons and clogging up the normal function of the neurons.
So in terms of doing something about Alzheimer's disease, are you trying to figure out ways to dissolve these proteins or prevent them from getting there to begin with? What do you do about this?
Right. Well, there are a few approaches one can take. One can try to block the formation of the protein. It's a small protein that's carved out from a larger precursor by enzymes. You can think of them as molecular scissors. And so there are small molecules designed to jam those molecular scissors and prevent amyloid from forming. And such agents are in clinical trials right now and are promising in some ways. And there are other attempts to try to block the aggregation of amyloid and its downstream toxic effects and otherwise clear it out of the brain. And all of these have the potential to be helpful in if not treating, at least preventing Alzheimer's disease.
So it sounds like this is building up in your body like about a lot of other things that we don't want to build up in our body. Would this be a drug that you would take that would prevent this from happening in the future? Would you, like people take statin drugs, people take other drugs, would you have an Alzheimer's drug, hopefully, at some point that you just take and prevent you from getting the disease?
I think that's the ideal situation, and that is a good analogy. We take these statins to, when our cholesterol levels get to be too high, amyloid building up in the brain is not a good thing, and it would be ideal to intervene therapeutically in a preventative manner before the signs and symptoms of Alzheimer's disease occur.
Well, thank you very much for telling us about your work in that direction, and I look forward to hearing more about it.
That's my pleasure. Thank you.